Understanding sciatica. What is it? Sciatica is a pain that you shouldn't ignore. It's not just a simple backache. Sciatica is a specific type of pain that follows the path of your sciatic nerve. This nerve runs from your lower back, through your hips and buttocks, and down each leg. When you have sciatica, you might feel pain anywhere along this path. The pain of sciatica can vary. Some people describe it as a mild ache. Others say it feels like a burning sensation or a sharp shooting pain. You might also experience numbness, tingling, or weakness in the affected leg or foot. These symptoms can make simple tasks like walking or sitting quite challenging. Sciatica usually affects only one side of the body. There are several reasons why you might develop sciatica. One of the most common causes is a herniated disc. If one of these discs slips out of place or ruptures, it can press on the sciatic nerve. This pressure is what causes the pain and other symptoms of sciatica. Another frequent cause of sciatica is spinal stenosis. This condition occurs when the spaces in your spine narrow. As these spaces get smaller, they can put pressure on the nerves that travel through the spine. When this happens to the sciatic nerve, you experience sciatica. Sometimes sciatica can be caused by a condition called piriformis syndrome. The piriformis is a muscle in your buttocks. When it comes to treating sciatica, there are several traditional approaches that doctors often recommend. One of the most common is physical therapy. A physical therapist can teach you exercises to strengthen the muscles that support your back. They can also show you stretches that can help relieve pressure on the sciatic nerve. Medications are another traditional treatment for sciatica. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce inflammation and pain. In some cases, doctors might prescribe stronger pain medications or muscle relaxants. Heat and cold therapy can also be effective for managing sciatica pain. Applying a heating pad to the affected area can help relax tense muscles and increase blood flow. On the other hand, using an ice pack can help reduce inflammation and numb the area, providing temporary pain relief. Some people find that alternating between heat and cold works best for them. Section 4. Innovative solutions. Nerve flossing and traction. Nerve flossing is a technique that's gaining popularity for treating sciatica. It's also known as nerve gliding or neural mobilization. The idea behind nerve flossing is to gently move the sciatic nerve through its pathway. This can help reduce tension on the nerve and improve its mobility. To do nerve flossing, you perform specific movements that stretch and relax the sciatic nerve in a controlled way. One simple nerve flossing exercise involves sitting on the edge of a chair. You extend one leg out straight, flexing your foot towards your shin. Then, you tilt your head back slightly. Next, you point your toes and bring your chin to your chest. You repeat this sequence several times. Traction is another innovative solution for sciatica. It involves gently pulling on the spine to create space between the vertebrae. This can help relieve pressure on the sciatic nerve. There are different ways to apply traction. Section 5. Gravity-defying remedies, inversion tables, and dead hangs. Inversion tables are devices that allow you to hang upside down or at an inverted angle. The idea behind using an inversion table for sciatica is to use gravity to decompress your spine. When you're inverted, the pull of gravity can help create space between your vertebrae. This can potentially relieve pressure on the sciatic nerve. Some people find significant relief from their sciatica symptoms through regular use of an inversion table. To use an inversion table, you strap yourself in and slowly tilt back. You can start with a slight angle and gradually increase it as you get comfortable. Most experts recommend starting with just a few minutes at a time. Dead hangs are another gravity-based remedy that some people find helpful for sciatica. A dead hang involves hanging from a pull-up bar with your feet off the ground. This allows your spine to decompress naturally. The theory is that this can help relieve pressure on the sciatic nerve much like an inversion table does. Section 6. When to seek professional help. While many cases of sciatica can be managed at home, there are times when you should seek professional help. If your pain is severe or doesn't improve after a few weeks of home treatment, it's time to see a doctor. You should also seek medical attention if your sciatica is affecting your daily activities or quality of life. A healthcare professional can provide a proper diagnosis and recommend appropriate treatments. It's especially important to see a doctor if you experience certain symptoms along with your sciatica. These include sudden, severe pain in your low back or leg, numbness or muscle weakness in your leg, or problems with bladder or bowel control. These symptoms could indicate a more serious condition that requires immediate medical attention. When you do see a doctor for sciatica, they'll likely perform a physical exam. They might ask you to walk or do certain movements to see how your pain responds. They might also test your muscle strength and reflexes.